a feeling of tightness in the chest, burning sensation, indigestion, shortness of breath, pallor, sweating and fatigue are the first symptoms of a heart attack. However, 1/4 of heart attacks can occur without any symptoms, and in some patients the first symptom may be a heart attack. Whatever the outcome, complaints similar to heart attacks need to be taken seriously. Pain that indicates a heart attack. It is a pain that starts as pain, burning and squeezing in the chest, moves down to the left arm and little finger, and spreads towards the neck area. Cold sweat accumulates on the forehead. Sometimes a heart attack begins with very sudden and severe symptoms and can be easily diagnosed. However, in many people, the event begins with a slow and mild pain or discomfort, and by the time it is realized what is happening, it may be too late for the patient. Along with the pain, cold sweats and nausea may also occur. In some people, symptoms may be very subtle. Especially elderly patients and diabetic patients may feel almost no pain and may have a heart attack with complaints of only shortness of breath and cold sweats. Seconds are precious during a crisis. Time is of the essence during a crisis. A health institution should be reached as soon as possible. The patient should not continue to go to the hospital on his own and should never continue walking or climbing stairs, because continuing the activity means that the heart, which is already unable to receive oxygen, increases its demand for oxygen even more. Therefore, some precautions should be taken when a crisis situation arises. As soon as you feel the symptoms of a heart attack begin, be sure to sit and rest where you are and do not stand. If you are wearing a shirt and tie, loosen the collar area of the shirt and the tie and try to freshen up. If you have an aspirin tablet with you, chew it. If the crisis catches you while you are alone, call the closest person. If you have a phone, or ask for ambulance help. If complaints such as dizziness and fainting occur, try to cough forcefully. This will speed up the heart rate. If you have someone experienced in first aid with you, it will help. However, if the person next to you has not received any training on this subject, do not allow him to intervene and tell him to call an ambulance. Open windows and doors and ensure oxygen intake. If you are caught in a crisis inside your vehicle, immediately pull over and ask for help. Tobacco use habits such as cigarettes, cigars, pipes and hookahs should be abandoned. If a person who has had a heart attack continues to use tobacco, the risk of a second attack increases by at least 2 to 3 times. Care should be taken to be more active. Regular exercise programs will reduce stress and depression. It will help keep weight, cholesterol and blood pressure balanced. Care should be taken to eat healthy. In this way, the person recovers faster, keeps his weight under control, and prevents blood cholesterol levels and blood pressure from increasing. One should never make the mistake of saying, "I'm on medication anyway, nothing will happen to me," because lifestyle changes are as important as medications for heart health.